Right now, before you do anything else, cough once. Just a small one. Right where you are sitting. Did you feel it? That small release of pressure the moment the cough happened. That fraction of a second where your body did not hold. That is not a bladder problem. That is not a weakness problem. That is a timing problem. And timing can be retrained. Most women over 60 who leak when they cough, laugh, sneeze, or lift have been told the same thing for years. Do your Kegels. Lose some weight. This is just what happens after menopause. Some of them have done Kegels every single day for a decade and seen no change. Some of them have an extra pair of underwear in their purse right now. Some of them have stopped going to the gym, stopped jumping with their grandchildren, stopped laughing too hard in public because they cannot trust their own body anymore. What no one has told them, what no 15-minute appointment has ever made time to explain, is this. The muscle is still there. It is not too weak to work. It just forgot how to fire before the cough happens, by a fraction of a second, and there is a 3-minute daily practice that retrains that timing back into your body without surgery, without medication, and without doing a single Kegel the way you have been doing them. I am Dr. James Carter. I have spent over 2 decades as a cardiothoracic surgeon, standing across the operating table for more women in their 60s and 70s than I can count. And one of the patterns I have watched in the prep rooms before cardiac surgery, in conversations with the urogynecology colleagues who treat these women every day, is the pattern I am about to walk you through, because there is no billing code in a 15-minute appointment for teaching this. There is no pharmaceutical campaign funding the explanation. And there is no profit margin in a free 3-minute daily practice that resolves the symptom most women have been told to live with for life. If this channel reaches you tonight, subscribe and help us reach 100,000. Every subscriber means one more woman finds out tonight that her body is not broken. She has been doing the right exercise for the wrong problem for a decade. In the next 16 minutes, I'm going to show you exactly what is happening in the milliseconds between your cough and your leak. The 10-second self-test that will tell you whether you have been doing Kegels with the wrong muscles for years. The story of a 66-year-old retired teacher who carried an extra pair of underwear in her purse for 14 years before a single appointment changed everything. And the 3-minute daily protocol that retrains the timing reflex back into your body in 6 weeks. Stay with me, because once you understand what is actually happening underneath the skin of your lower abdomen, you will never look at this condition the same way again. Before we go further, the warning section, because this matters. There are forms of bladder leakage that need a real medical evaluation, not a YouTube exercise. If your leakage happens without coughing, sneezing, lifting, or laughing, if you feel a sudden overwhelming urge to urinate that you cannot control even when your bladder is barely full, that is a different condition called urgency incontinence. It involves the bladder muscle itself and requires medical evaluation. If your leakage came on suddenly in the last few months without explanation, if you feel pressure or fullness in your pelvis, like something is bulging or descending, that may be pelvic organ prolapse and warrants an exam by a urogynecologist. If you have any neurological changes alongside the leakage, weakness in the legs, numbness, changes in bowel control, see a doctor this week. The protocol I am about to walk you through is for stress urinary incontinence, the kind that happens when physical pressure spikes in your abdomen. If that is what you have been dealing with, stay with me. The next 16 minutes are for you. Now let me explain what is actually happening underneath the skin of your lower abdomen, because once you see it, the entire condition reorganizes itself in your mind. Your pelvic floor is a sheet of muscle that sits like a hammock at the base of your pelvis. It supports your bladder, your uterus, and your rectum. It runs from your pubic bone in the front to your tailbone in the back, and it spreads side to side like a webbed floor at the bottom of a basket. There are 3 layers, and the deepest is called the levator ani group. The strongest muscle in that group is called the pubococcygeus. That is the muscle responsible for holding your urethra closed against pressure. When this hammock is functioning properly, it does something most people have never thought about. It works automatically. Every time you cough, sneeze, laugh, lift, or jump, the abdominal pressure inside you spikes in milliseconds. A cough generates a sudden burst of pressure that wants to push your bladder downward and force urine out through the urethra. To prevent that, your pelvic floor pre-contracts. It fires a fraction of a second before the cough actually happens. Your brain anticipates the cough, sends the signal to the pelvic floor, and the muscle clamps the urethra shut just before the pressure wave arrives. By the time the cough happens, the muscle is already holding the line. This pre-contraction reflex is automatic in a healthy pelvic floor. You do not think about it. You do not try to do it. It just happens, the way blinking happens when something flies toward your eye. After menopause, after decades of disuse, after pregnancies and deliveries, after the slow accumulation of small disconnections between your brain and the muscle, that reflex slows down. The muscle is still there. The muscle is often still strong enough, but the timing has changed. Now the cough happens, and the pelvic floor contracts a half-second too late. In that half-second window, before the muscle catches up, abdominal pressure pushes a small amount of urine through the urethra. That is the leak. Read that again. The leak does not happen because the muscle is too weak to hold. The leak happens because the muscle arrived too late. This is the part that matters more than anything else in this video. Standard Kegels train strength, 3 to 5 second holds, long contractions. They build the slow twitch fibers of the pelvic floor. Slow twitch fibers are good for sustained tone, like holding posture or supporting organs against gravity over hours. They are not what fires in the millisecond before a cough. The muscle fibers that fire in that millisecond are called fast twitch fibers. They are different physiologically. They produce explosive, immediate contractions, and they are trained completely differently than slow twitch fibers. This is why so many women have done Kegels for 10 years and seen no change in their leak. They have been training the wrong fibers. They have been building strength when the problem was speed. Now I want you to do something with me right now. This will take 10 seconds, and the result will tell you something almost no woman discovers on her own. Sitting where you are, try to engage your pelvic floor. Squeeze the way you would if you were trying to stop the flow of urine midstream. Hold it. Now without releasing, check 3 things on your own body. Are your glute muscles clenched? Are your buttocks tight against the chair? If yes, you are squeezing your glutes, not your pelvic floor. Is your breath being held? Are you frozen on an inhale? If yes, you are using your diaphragm, not your pelvic floor. Is your stomach sucked in or hardened? Are your abs pulled tight? If yes, you are squeezing your abdominal wall, not your pelvic floor. If even one of those 3 things is happening, you have just discovered something most women never learn. You have been doing Kegels wrong for years. You have not been failing at the exercise. You have been doing a different exercise entirely, and it has not been working because the muscle you needed to engage has been quietly sitting there, untrained, while the muscles around it did all the work. A correct pelvic floor contraction feels like a gentle internal lift, like an elevator rising 1 floor inside your lower body. Your glutes stay relaxed, your breath stays moving, your abdomen stays soft. The lift comes from inside, not around. If that is the first time you have felt the difference, I want you to stay with me. Because this is exactly the moment the protocol I am about to give you starts to work, and not before. Tell me which one you found. Type glutes in the comments if you noticed your buttocks were tight. Type breath if you were holding your breath. Type stomach if your abdomen was hardened. Or type lift if you felt the correct internal lift on the first try. Whichever you write, you have just identified the exact correction your body needs. Margaret is 66, a retired teacher in the Pacific Northwest. Her colleague, a urogynecologist I have spoken with many times, shared her case with me last year because the pattern was so common she said I had to hear it. Margaret had been leaking for 14 years. She had carried an extra pair of underwear in her purse since her late 50s. She had stopped Pilates. She had stopped running. She had bought pads in bulk online to avoid the grocery store cashier. She had done Kegels every day for the last decade. She showed her doctor an app on her phone that tracked her Kegel sets. The app said she had completed over 1,800 sessions. Her leak had not improved by a single drop. She had a consultation for sling surgery. The quote was $9,000 out of pocket after her insurance. The surgeon was kind. He explained the procedure. She went home and could not sleep. A friend mentioned a pelvic floor physical therapist. Margaret had never heard of that profession. She thought her friend was making it up. She made an appointment because she had nothing left to lose. The physical therapist examined her in the first visit. She told Margaret 2 things in that visit that no doctor had ever told her. The first was that Margaret was doing her Kegels with her glutes. Her breath held and her stomach sucked in. She had been training the wrong muscles for 10 years. The second was that even when Margaret was contracting the right muscle, the timing was off. Her pelvic floor was not pre-contracting before her coughs. It was contracting after. The therapist taught her 2 things: how to feel the correct muscle, and a single technique that retrained the timing reflex. The technique took 3 minutes a day. 6 weeks later, Margaret's leak episodes had dropped by 70%. By month 4, they were essentially gone. She did not have surgery. She did not buy a single pad in the last 8 months. She told her colleague that what made her saddest was not the lost time. It was the years she spent thinking her body had failed her, when really nobody had ever explained how the body actually works. Now I am going to walk you through the exact protocol. It has 3 parts. Total time, 3 minutes a day. The first part finds the correct muscle. The second part trains the fast twitch fibers. The third part rebuilds the timing reflex itself. Part 1. Finding the muscle. 60 seconds. Sit upright in a chair. Feet flat on the floor. Soft breath in through the nose. Soft breath out through the mouth. Now imagine 3 things at once. Imagine you are stopping the flow of urine midstream. Imagine you are picking up a small blueberry with your vagina. Imagine your 2 sit bones. The bones at the base of your buttocks are gently drawing toward each other. That combined sensation is the correct contraction. You should feel a gentle lift inside, not a clenching outside. Check yourself. Glutes relaxed. Breath moving. Abdomen soft. The lift comes from inside. Hold for 2 seconds. Release for 2 seconds. Do this 10 times. Part 2. Quick flicks. 60 seconds. This is what trains the fast twitch fibers, the ones that fire in the millisecond before a cough. Same posture, same correct contraction, but now the rhythm changes. Contract for 1 second, release for 1 second, contract, release. 30 repetitions in 60 seconds. These are called quick flicks because that is exactly what they feel like. A flick of contraction, a flick of release. No long hold, no deep squeeze. Just sharp, quick activations that train the muscle fibers responsible for the cough reflex. This is the part most women have never been told to do. Standard Kegels do not include quick flicks, and without quick flicks, the timing reflex never rebuilds. Part 3. The knack. 60 seconds. This is the most important part of the protocol, and it is the part that makes the entire thing work. The knack is a clinically validated technique that retrains the precontraction reflex back into your body. Studies in the Journal of Urology and in pelvic floor rehabilitation literature have shown that the knack alone, practiced consistently, reduces leak episodes by 50 to 70% in women with mild to moderate stress incontinence within 4 to 6 weeks. Here is how you do it. You're going to fake a cough 10 times, but before each fake cough, you will deliberately contract your pelvic floor a fraction of a second before the cough happens. Sit upright. Now deliberately contract the pelvic floor with the same correct lift you practiced in part 1. Then, with the contraction held, fake a small cough. You will feel the muscle holding the urethra closed against the pressure wave. Release. Wait 3 seconds. Then contract again before the cough this time. The precontraction has to come first, always. Then the cough. Then release. Repeat 10 times. What you are doing here is teaching your nervous system to associate the moment before a cough with a pelvic floor contraction. After 4 to 6 weeks of consistent practice, this association becomes automatic. Your brain begins precontracting the muscle before your coughs in real life, without you thinking about it. The reflex returns. That is the entire protocol. 3 minutes. Once in the morning, once in the evening, if you want to accelerate the result. That is all. If this video has reached you tonight, you are part of a community of women in their 50s, 60s, and 70s who have been carrying this in silence for years. The next person who needs to hear what you just heard is 1 click away from finding it, or never finding it. Most viewers watch a video like this, find it useful, close the tab, and forget the channel exists. The next time they leak in the parking lot, they will not remember where they heard about the knack. They will not remember the name of the muscle. They will go back to the pads. If you tap subscribe right now, you do not just help this channel. You make sure the next woman searching for an answer at 3 in the morning, the night after she leaked at her grandson's birthday party, finds this video before she signs a surgical consent form. That is the work. That is what we are doing here. Now, the 5 mistakes that ruin this protocol. Mistake 1. Doing Kegels with your glutes, your breath, or your abs. We covered this in the self-test. Most women have been doing this for years. Check yourself every single time. The lift comes from inside, not around. Mistake 2. Skipping the quick flicks. Standard Kegels alone do not retrain timing. The quick flicks are what build the fast twitch fibers responsible for the cough reflex. If you are only doing long holds, you are training strength, not speed. You will get a stronger muscle that still fires too late. Mistake 3. Skipping the knack. The knack is the part that rebuilds the reflex itself. Without it, you can have a perfectly strong pelvic floor that still does not fire in time. The knack is what teaches your nervous system to pre-contract. Do it every single day. Mistake 4. Doing too many. Some women hear, Kegels are good, and decide to do hundreds of them per day. This is its own problem. A hyper-tightened pelvic floor, called a hypertonic pelvic floor, causes the same leak through a different mechanism. The muscle is so tight it cannot generate a quick, coordinated contraction. More is not better. 3 minutes a day is the correct dose. Mistake 5. Quitting before week 6. The reflex takes time to rebuild. The first 2 weeks are neural reactivation, your nervous system relearning the timing. By week 4, the muscle fibers are firing more reliably. By week 6, the pre-contraction starts becoming automatic in real life. You may not see significant changes until week 4 or 5. Do not stop. The protocol works on a clock that is longer than most women give it. 2 more things matter, independent of the exercise itself. Hydration. Many women with stress incontinence reduce their water intake to limit how often they leak. This actually makes the problem worse. Concentrated urine irritates the bladder lining and increases urgency. Drink normally. Aim for 60 ounces of water spread across the day. Constipation. Chronic straining on the toilet puts repeated downward pressure on the pelvic floor and can weaken it over years. If you are straining, address it. Fiber, magnesium, adequate water, a footstool to elevate your knees during bowel movements. These small changes protect the work you are doing in your pelvic floor. And one more thing. If you have practiced this protocol consistently for 6 weeks and you are still leaking significantly, do not assume it has not worked for you. Find a pelvic floor physical therapist. This is a real medical specialty. Most insurance covers it. In most states, you do not need a referral from a urologist or a urogynecologist to see one. They will examine you, identify what is uniquely happening in your specific pelvic floor, and adjust your protocol accordingly. Many women see complete resolution of their symptoms after 8 to 12 sessions of pelvic floor physical therapy. Most have never heard of this profession before they walk in the door. Tell me your age in the comments. The protocol I just walked through works at 55, at 65, at 75, and beyond. Adults in their 50s are using it preventatively. Adults in their 60s and 70s are using it to reverse what they thought was permanent. Knowing where you are tells me which video to make next. There are women in this country tonight, hundreds of thousands of them, who are about to spend the next 12 months buying pads they do not need, avoiding family events they should be at, scheduling surgical consultations they should not have to consider. Some of them will go through with the surgery. Some of them will not, and they will spend the next decade adjusting their lives around a muscle that could have been retrained in 6 weeks. None of them will be told what you were just told. Not in a 15-minute appointment, not in a magazine, not by the brand of pads on the shelf at the grocery store, because there is no profit in 3 minutes a day. There is no billing code for teaching a 66-year-old woman the difference between strength and timing. That is exactly why this channel exists. Subscribe so the next woman who has stopped going to her grandson's soccer games finds this video before she stops going to one more. 3 minutes a day, 6 weeks. The muscle is still there. It just forgot how to fire. Tonight, you remind it.